Hey everybody, Dr. Schultz from the Centeno-Schultz Clinic. We're continuing our series on the thoracic spine, so thank you for checking in. Today we're going to be reviewing the 11 major causes of thoracic radiculopathy. So again, thanks for checking in, and let's get started. The goals of this presentation are to identify what in the world the thoracic spine is, what is a thoracic radiculopathy, and what are the 11 major causes of a thoracic radiculopathy. So the thoracic spine, as we've reviewed before, is that section of the spine that's below the neck and above the low back. It's sometimes referred to as the mid-back, and it's depicted here. It's this section of the spine. What is the thoracic radiculopathy? It's basically pain that's originating from irritation, injury, or compression of an exiting nerve root from the spine. It can vary in intensity, and the quality also can vary, but most patients describe it as an electrical or burning sensation. So let's kind of basically review some anatomy of the thoracic spine so you can understand the 11 causes of thoracic radiculopathy. This is a side view of the thoracic spine. As you can see that there are some bony building blocks, and they're identified right here. These are the vertebral bodies, and there's one on top of the other. They stack and make your spine. And sandwiched in between each of the bony building blocks is a vertebral disc. This is the front, and this is the back. This is the dinosaur bone that you feel when you touch someone's back. And if you see here, there's kind of a keyhole. The keyhole is very, very important because it's through this keyhole that the nerves exit the spine and go to their final destination in the body. So the major symptoms of a thoracic radiculopathy are pain, typically a burning pain. It also can refer along the distribution of the nerve. It can be across the chest, into the abdomen, down into the lower extremities. So what are the 11 causes of a thoracic radiculopathy? Number one is degenerative disc disease. So if you review again, how could that work? Here is the bony building block, and sandwiched in between the bony building block is a cushion or a wafer. That's called the disc. Now, if the disc gets narrowed, so too does the doorway through which this nerve exits. Hence, you may have compression, irritation, or injury of one of the exiting nerves. The second cause is a thoracic disc herniation. That's basically where the inner material of the disc is forcefully pushed out into the spinal canal, and is due to a defect in the sidewall of the disc. And this is depicted here. You can see this is a cross section. This is the front, and this is the back, the posterior. And you can see a nice sidewall similar to a car tire. And it contains the gelatinous inside of the disc called the nucleus pulposus. But with a disc herniation, there's a defect in the sidewall. Hence, the material pushes out, and it can rub up or compress that nerve, causing a thoracic radiculopathy. Number three, facet arthrosis or arthritis. Basically, a thoracic facet is a pear joint that occurs at every level of the thoracic, and for that matter, the spine. There's a joint on the right and the left. It limits rotation, and it also provides important stability. However, as you can see, and this is a side view, if this facet joint gets bulked up due to arthritis or trauma, it can then encroach or narrow the doorway through which the nerve leaves, leading to thoracic pain along the nerve, otherwise known as thoracic radiculopathy. Number four is a vertebral body misalignment. You may see this in an MRI or X-ray report. It's called listhesis. Listhesis is a slippage. If it slips forward, it's an anterior listhesis. If it slips backward, it's a retrolisthesis. And that's depicted here in this picture here. This is an illustration. You can see the bony building block. It aligns with the one above it. But if you go down here, this next vertebral body is actually displaced backward. It's posterior. And so too here in this X-ray, which you only can see a portion, all these line up beautifully until you come here. So this vertebral body is pushed back. When it's pushed back, the doorway through which the nerve can be narrowed or compromised, leading to, again, thoracic nerve pain. Scoliosis is the 5th cause of thoracic radiculopathy, and that's basically an abnormal side curve of the spine. It's depicted here. You can see some of these patients they tend to be listing to one side or the other, and you can see the curve here. It can either be congenital, patients are born with it, or it can be as a result of some degenerative changes. The 6th cause of thoracic radiculopathy are bone spurs. Bone spurs are basically an abnormal bony growth, and in this case, it can narrow the foramen, and that's depicted here. This is a cross-section, and this is the vertebral body, and you can see this extra bone here that's pushing back this way, and there's also some abnormal bone here from the facet joint, and the combination of these two bony growths is compression of that nerve root, otherwise known as thoracic radiculopathy. The 7th cause of thoracic radiculopathy is muscle strain. There's a large number of muscles in the thoracic spine that can be inflamed or injured, causing compression or irritation of the nerve. The 8th cause of thoracic radiculopathy is a spinal fracture. Otherwise, it can be mild or moderate. You can see it depicted here. It can lead to compression and irritation of the nerve. The 9th cause of thoracic radiculopathy is a spinal stenosis. Stenosis is a medical term. It basically refers to narrowing of the canal. You can have two types of stenosis. There can be a central canal stenosis, which is depicted here. This is a cross-section. This is the vertebral body. This is the disc where it would sit. Again, this is the front. This is the back. This canal here is known as the spinal canal and is patent. However, if you have a disc protrusion, like here, or some facet overgrowth, you can have profound narrowing of this central or foraminal canal, leading to thoracic radiculopathy. The 10th cause of thoracic nerve pain are tumors. They can either be benign or malignant, and if they are in close proximity to the nerves, they can cause irritation, pain, and dysfunction. And finally, infections. Yes, that's right. Infections can cause a thoracic radiculopathy, and the most common cause is herpes zoster, and that's depicted here. It's a viral infection, and it can affect the thoracic nerves and keep you and your loved ones on the side. This is what it looks like. It is actually going along the path of the nerve. It's a very painful condition. So we learned today about what in the world is the thoracic spine. We learned that the thoracic radiculopathy is irritation or compression of an exiting nerve as it comes out of the spine in the thoracic spine, and the 11 causes. If you or a loved one suffer from thoracic pain, I want you to consider giving us a consultation. We can do that either in office or on telemedicine. We are all board certified, fellowship trained physicians that have a deep compassion and understanding of the thoracic spine. Hope this helped. We'll see you next week.